All right, party people, we are back at it with another one. Today, we're going to be covering the phacomatoses. You might be wondering, WTF is that? Well, they are a collection of the neurocutaneous disorders. The main ones being neurofibromatosis type 1, neurofibromatosis type 2, tuberous sclerosis, von Hippel-Lindau, Sturge-Weber syndrome. They're all very high yield for USMLE. So let's get it. Now, if I was to give you a 2-year-old boy with writhing movements during sleep, as well as showing you this CT scan and this finding of the fingernail, how would you diagnose this? The answer is tuberous sclerosis. The key clinical features include seizures in children, writhing movements during sleep, subungual fibromas, these are the nodules under the fingernail, periventricular nodules seen on CT, as well as ash leaf spots, which is hypopigmented macules, or shagreen patches. These are hyperpigmented velvety lesions. Additional findings that you could see for tuberous sclerosis would be mental retardation, facial angiofibromas. Here you could have them in a butterfly distribution across the face and nasolabial folds. The subungual fibromas, which were seen here in the nail bed tumors shown previously, as well as renal angiomyolipomas. A biopsy of these will show vascular, muscular, and adipocytic components. For reference, tuberous sclerosis is autosomal dominant. It's associated with chromosomes 9 and 15, and they involve hamartin and tuberin proteins. Please know that seizures is the most common presenting symptom. While most cases are in young children, it can also present in teenagers / young adults. Moving on to neurofibromatosis type 2. Know that it's autosomal dominant. It's associated with chromosome 22. Findings could be congenital cataracts, meningiomas, bilateral vestibular schwannomas is the most classic and high-yield finding. As for von Hippel-Lindau, know that it's autosomal dominant, associated with chromosome 3. Findings could be retinal and cerebellar hemangioblastomas, and it's caused by the constitutive activation of hypoxia-inducible factor, HIF. This leads to the vascular growths. As for neurofibromatosis type 1, know that it's autosomal dominant, associated with chromosome 17, and features are axillary groin freckling, flesh-colored skin lumps, neurofibromas, obviously, café au lait spots, these are hyperpigmented macules, you can see pheochromocytomas, and brain tumors such as oligodendrogliomas or ependymomas. As far as Sturge-Weber, associated primarily with the port wine stain, aka nevus flammeus. These are usually sporadic due to somatic mosaicism. Port wine stain is often in the V1 ophthalmic distribution. They may also appear as violaceous papules. Sturge-Weber can be associated with leptomeningeal angiomas. These can lead to seizures and glaucomas. Now, these are all phakomatoses. You can casually drop this term in front of your friends, essentially being a subtle flex. All right, that's it for this one. Go crush it.